Despite being a medical student and being familiar with antimicrobial resistance for several years, my desire to spread this idea started only after me realizing that there is a big issue, which is considered as top 10 threat that humanity may face according to WHO. But not everybody understands its importance. Now I'm here on this stage to give you some little understanding about what can happen if we are going to neglect antimicrobial resistance. So let me start. 1928, it is the year when one of the greatest weapons of medicine was created. Alexander Fleming. I hope you know this name or at least heard in some part of your biology classes because he is the one who discovered it. You don't need a huge knowledge of medicine or biology to understand what are antimicrobials. The only thing you need is to listen carefully. So, what are antimicrobials? Antimicrobials are agents intended to kill or inhibit the growth of bacteria. They not only include antibiotics, they include fungicides, parasiticides, antiviral drugs, and some antiseptics and some disinfectants that were really popular during COVID-19 also have some antimicrobial effect. As I have mentioned it before, it was Fleming who discovered antibiotics in 1928 by accident. But since then, the whole course of medicine changed drastically, allowing physicians to treat so many bacterial diseases that were #1 causes of death, even in developed world, before the development of antibiotic. And for this big breakthrough, Fleming, with other 2 scientists who contributed to the development, got their deserved Nobel Prize. And during his Nobel Prize, Alexander Fleming already mentioned it, or we can say warned us. The time may come when penicillin may be bought by anyone in the shops. And then there is a danger that ignorant man may underdose himself by non-lethal quantities of the drug and makes the bacteria resistant. Doesn't it resonate with our current world? It has not been even 100 years since the development of first penicillin, but we, human beings, are already on the edge of the crisis called antimicrobial resistance, which was predicted by Fleming himself. Now, what is antimicrobial resistance? Antimicrobial resistance is when the bacteria is no longer killed by antibiotic, or we can say that bacteria may able to avoid the effect of, the pathogen may able to avoid the effect of the drug. And so now you can think how these tiny microscopic unicellular organisms may avoid the effect of the substance which is created by such an intelligent human being. It is simple. Simple mechanism of evolution, which is called natural selection. What is natural selection? It is when organisms, more favored, more adapted ones, can survive in a certain environment and pass their genes to their offsprings or their peers. It means some certain bacteria may survive the effect of antibiotic and pass this experience to other bacteria in the form of a gene. Now, when you understand all the processes, you may think, why should I care about this problem? I would like to ask you to pay attention to these numbers. 1.27 million people. It is the number of patients who are dying as a result of antimicrobial resistance now. 10 million people. It is the number of patients who are going to die in 2050 if we are going to neglect the crisis of antimicrobial resistance. For you to be able to compare, look at this pie chart. 10 million people already were dying in 2016 as a result of cancer. And if we are not going to take any actions, by 2050, we are simply making AMR as dangerous as cancer. And for you to be able to understand and to feel yourself in the shoes of the ones who are already suffering, I would like to give you two examples, two cases. First one, let's imagine that you feel bad. You have an ache in your throat. As a clever patient, you should go to your physician. And what your physician successfully diagnoses you with throat infection. And what is they're gonna do is probably to prescribe you several pills, antibiotics being one of them. You take them for several days, you feel good, and come to your normal life again. But there is a second case. Again, you feel bad, you have an ache in your throat. As a clever patient, you go to your physician, you are successfully diagnosed with throat infection again. But do you know what is different now? Now you are infected by an infection which is resistant to all types of antibiotics that exist now. And how do you think? What is your physician going to do? More likely, they are going to prescribe you immune boosters to support your immunity, to fully rely on your immune system, while they will find other options, other treatments, which are hardly available in developing and underdeveloped world. And this statement of mine clearly explains this map. You can see that by 2050, Asia and Africa are going to suffer and going to be vulnerable to AMR the most. And I believe the only reason for that is because they don't have an access to other options of treatment, or they cannot support and they do not have access to latest types of antibiotics. And in the worst scenario, what is going to happen is the patients from these countries going to wait while the infection will reach their lungs, their blood, other parts of the body, which will cause sepsis and other consequences, bad consequences, of course, and cause their death, painful death. And now, second one doesn't sound good, yes? But it is something that is waiting for us in our future if we are going to neglect antimicrobial resistance. When you hopefully felt yourself in the shoes of the ones who are already suffering, I want to give you the main causes of AMR. According to WHO, there are 6 main reasons. First one is overprescription among physicians. And of course, there is a self-prescription among patients themselves in countries where antibiotics are available without recipe. Second one is patients who are not finishing their treatment. Third one is wide usage of antibiotics in agriculture to increase the production of livestock and fish. First cause is poor control of infection at hospitals. Fifth, poor sanitation and hygiene. And the last one is the lack of development of new antibiotics. Now, when we understand everything about antimicrobial resistance, I would like to move into more optimistic part of my speech, which are solutions or actions that can be taken by every of us, or on 3 levels, I would say. First level is global level. What can be done on a global level is the creation, the development of new classes of antibiotics. As a matter of fact, look at this chart. The last class of antibiotic was created in 1987. And it was lipopeptides. But now, 1.27 million already dying, and they do not have another options of antibiotics. I'm not denying the fact that there may be some little discoveries in recent 5-10 years, but the problem is that they are not supported. They are not financially supported. So what should be done on a global level, of course, is a global financial support of the development of new drugs. Second level is national. On a national level, the most important thing is the creation of cultures that consciously uses antibiotics. These are doctors who prescribe less, these are patients who take less, and other fields who also use less antibiotics. But in order to create this culture, we need to take actions on a personal, individual level. Something that can be done by each of us, by you, by me. What can be done on an individual level? First one is, please, if you feel bad, go to your physician. Do not self-prescribe antibiotics if it's available in your country without recipe. It's not the candy that can be bought in a shop. It is a drug that should be guided, prescribed by your physician. Second one, if you go to your physician, don't force them to prescribe antibiotic. There are so many patients who simply go and ask to prescribe some certain drug because some certain random neighbor or friend started to feel better. Your physician spends more than 10 years of their life in the field of medicine, so hopefully they know what to prescribe better than your random neighbor. Third one, if you are prescribed by antibiotic, take them as much as you have been prescribed. Because by taking them 3 or 4 days while you have been prescribed for 10 days, you simply increase the chances of your bacteria to become resistant and pass these genes to other types of bacteria, and simply this type of drug will not be effective the next time. And the last but not least, do simple wash. It's not simply washing your hand. It is water, sanitation, hygiene, and these simple things are actually key to the prevention of so many infectious diseases. And the prevention of infectious disease is equal to decreasing the number of patients who are going to take antibiotics. Now, at the end of my speech, some of you may still think, 10 million lives? It doesn't deserve my attention, maybe, yes? But I would like to highlight that 10 million lives are equal to the population of almost 100 countries on this earth. And furthermore, these 10 million lives, the death or the disease of these 10 million lives are going to cause $100 trillion damage to global GDP. And the most importantly, you can be among these 10 million lives. Your close one may be among these 10 million lives. And since no one is guaranteed and everyone is touched by this crisis, I mean by everyone, not only humans, animals, plants, every living being on this earth, I strongly believe that antimicrobial resistance deserves global attention. Thank you.